Hello, everyone. Welcome to another episode of the Overcoming Chronic Illness podcast. I'm pleased to be joined today by Bridgit Danner, an acupuncturist, and she has an extensive amount of experience working with folks suffering from mold illness. So I'll turn it over to her to give us a background on, if you could please, Bridgit, give us a background on who you are and just how you kind of got involved with working with folks with chronic illnesses. And thank you for joining me today.
Yeah, thanks for having me. I always love to talk, to be honest. Love to talk health. So I started my career as an acupuncturist in 2004. I honestly got into natural medicine like as I was an environmentalist. I just kind of believed in that lifestyle. Didn't really have any major health issues yet that I knew about. And then I started my career in Portland, Oregon. I moved there and did start having more symptoms um, around, gosh, at first I would say, some increasing gut symptoms, anxiety, pain levels, insomnia, and all kind of around the same time. I had moved into a new home, gotten married, had a baby, started a clinic. So stress was sort of always blamed for my symptoms, and I just diligently like chipped away at them, while I was growing my career and my family, and got super paleo, clean diet, was just really trying to do all the things to feel better. I definitely didn't get anyone asking me about mold or anything for quite some time. Um, I would have like ups and downs, probably more down in the winter with the weather, and getting a lot of colds and flus. I would say some of my symptoms weren't the typical ones you think of for mold, so we could chat more about that if you want later. Um, and then really, I had a great like upswing. I was studying functional medicine, and I did some testing. I was feeling good, followed by like a pretty hard downturn in the fall when everything got wet again, including my basement. And I just started working from home to do my online business. And then I got strep throat, and I wasn't like bouncing back from that. And I was going to a naturopathic college, getting IV therapies. And, I was just sort of like at the end of my rope. I was just like, you really can't tell me to live any healthier than I am. Uh,
Mhm.
and that was the first time someone did ask me about my living environment. And I think mold came up, but they also tested me for some other like autoimmune things. They did run some other testing. So I feel like everyone with mold remembers that first conversation where someone suggested, what about your house? Tell me what's changed. And we did have some like recent leak in the basement, but we had always had a musty basement. And I came home and told my husband at the time, and he was like, yeah, I've been wondering, like, let's check. So that was sort of the beginning of that adventure. And then that really shifted my career too. Like, I was on my own, kind of studying about functional medicine and learning about the body in a different way than the Chinese system. But now I really had to kind of go all in to work on my own health. So I learned a lot, and kind of layered that on top of what I had already learned. I think by the time I got my diagnosis, I've been practicing acupuncture, 10, 12 years, something like that. So, um, I eventually like shifted from doing like more like pain and women's health to doing detox and mold. I just felt like I have such a body of knowledge on this now. And once I was well enough, like I really wasn't well enough to do this, kind of work for a while.
Mhm.
Uh, I really wanted to do it, and it's definitely needed, as you know. So
Indeed.
I've
Yep.
been happy to be able to get better myself and contribute to this community.
It's amazing that you got better, and that's great. And I don't know about you, and we won't drop any names here, but I don't think I know anyone who's, passionate about treating folks with chronic illnesses that didn't have health issues themselves. Like it's I don't know. Just off the top of your head, again, not naming names, but do you know anyone that's like steeped in
I
this?
have some friends who like their spouse was more the one or their
Sure. Okay.
child,
Touche.
and that's something that got them into it.
That's fair. Yeah.
But yeah, I mean, I think there's probably some naturopaths and such who
There must
just
be.
taken on, right? Like they just kind of, I don't know, were willing to research difficult cases. So the
Hmm.
difficult cases came to them more and more, right?
Yeah.
So yeah.
Yeah, that's true. Yeah, sometimes it is like immediate family members too. That's true. But yeah, it's just it seems like there's at least rarely is there more than one degree of separation. I think somebody who's had a complex chronic illness in their life, but
Yeah,
sure, there's
yeah.
exceptions.
Which I think can be really helpful. Like I have so much of a better understanding of what it's like to go through it.
Hmm.
Um, and something that I definitely experienced sometimes when I was getting mold treatment was just feeling like my practitioners, um, didn't always know what it was like to go through it and
Hmm.
all the layers of emotion and struggle. So, yeah, in that sense, like I'm happy that I went through it.
There's a silver lining, but yeah,
Yeah.
builds a lot of compassion and empathy, to say the least. Circling back to something you mentioned, how you had some atypical symptoms, which if you don't mind sharing, what some of those atypical mold symptoms were, I'd be really curious.
Yeah, I mean, now that I specialize in mold, I feel like the top two are probably brain fog, fatigue.
Hmm.
I wouldn't say those were my first two things at all. I would say my first few things were like frequent colds and flus,
Hmm.
irregular periods, and chronic pain.
Hmm.
Um, so nobody really, and probably the digestive stuff too was in there. I feel like those things still could be quite overlooked for mold. All those things.
Yeah, I mean, I think differential diagnosis wise, it wouldn't be the first place that most of us would think to like, oh, you've got, irregular menstrual parameters, like it must be mold toxicity. Like it would be that tends to be pretty far down the DDX tree, I think, for most clinicians. And I mean, and quite frankly, I mean, with most patients, in my experience, it's relatively speaking rare that it's mold illness that's driving that. But sometimes it is, obviously. So it's good to know about that.
Yeah. Yeah. Sometimes it is. So, yeah, just good to consider because you can end
Mhm.
up, spending a lot of time and maybe some of the interventions will help, right? Some like herbs helped my immune system, you know, probably some herbs help my periods. But like, I always say to people, like, if you're just not really getting to where you want to
Mhm.
be, like, look at environmental toxins.
Absolutely. Yeah. It's, in my opinion, it's like on the DDX list until proven otherwise. But yeah. Now, I was going to talk to you about this a little bit later on, but I'll just bring it up now as it's kind of relevant to what we just talked about. So, say if all the folks that you've worked with over time who are suffering from mold illness, how often would you say that? Um, so, sorry, let me paint the picture a little bit more. So, folks who are suffering from mold illness, they have say dysmenorrhea or other notable menstrual cycle related issues going on. How often do you find that when you bring in hormone balancing support or estrogen detox support or whatever it is they specifically need from their Dutch test results or whatever happens to be, how often do you find that hormonal support is like a really pivotal part of their protocol? Like it's like, oh, I went on those herbs or I started that protocol and man, like I just feel notably better? Or is it really more of a background, like supportive thing that doesn't necessarily contribute a lot to their overall mold recovery?
So you're saying a patient who does have mold and has some hormone issues,
Hmm.
how much help will the hormone support deliver, more or
Yeah.
less?
Yeah. More or less.
I think it really depends, and it's I think it's a question like I think you've been interviewed by Scott with Better Health Guy, and
Hmm.
we were talking about something, and I thought, I because of my natural background, I did not do any, exogenous hormones until pretty recently in my story. And I really wonder if I had gotten a little more support around getting those doses right and trying things safely, like if that could have really made a difference to just kind of get my recovery going. Like this is just an open question. You're welcome to kind of weigh in as well because it wasn't something I did early on. I probably did do some herbs and stuff. In my
Hmm.
case, that wasn't enough. The herbs
Hmm.
and stuff really weren't enough. Some a little bit, like some helping once, especially once I was getting really better. But I wouldn't say, my spotting between periods got better until a long time into the process, like once I was out of mold and all that. So I do kind of ponder now, like if, and I'm not a practitioner who can prescribe hormones. So it's probably also why I'm not as versed in this, but I do kind of wonder if we give hormones sooner, what would we see as far as results? Yeah. How about you? Have you kind of tried different hormones at different points with folks going through mold?
Um, More so like the non-hormone replacement therapy type treatments, like more like hormone regulating herbs. But I've definitely had many patients with mold issues or other chronic health issues where they have been on bioidentical hormones or whatnot. And sometimes they're really, really helpful for sure. I've had a handful of patients over the course of time where the hormone regulating support, like so herbs like, chaste tree and wild yam and um, Angelica sinensis, like those are kind of my three favorite hormone regulating herbs that I use pretty often. I've had a handful of patients where like that just made a huge difference. Like they felt so much better from that. Like their
Awesome.
mood improved, energy improved, sleep improved, like just everything was so much better, in including improving their menstrual parameters. But I find a majority of patients, whether they're responding well to herbs or they're, benefiting from hormone replacement therapy, I find that it doesn't really lead to like huge clinical improvements overall. It can really improve or reduce their menstrual related symptoms. But in terms of like just generally improving energy, reducing pain, helping brain fog, I find it's just not super, super often that intervention makes a big difference in that way. So I was kind of wondering if you've had a similar experience, like with clients that you've worked with, or if you found it to be more impactful than I have.
Yeah, I think it's a little bit of a mixed bag, but yeah, I think ultimately, obviously, it's not going to be enough if the client's still in mold, right? Like,
Of course,
can
yeah.
probably like regulate the HPA access a little bit for a while, but
Mhm.
I don't, ultimately mold's going to override because it overrides everything. So,
Of course, yeah.
yeah. So yeah, I mean, you know that, and I'm sure your listeners do too. But just to just emphasize, yeah, like anything we talk about today will not work until you're out of mold. Like, just it just won't work. It'll just be a band-aid. So I always have to kind of remind people of that as well.
Yeah, and thanks for clarifying that point. And yeah, not insinuating like just hormone support, but more like you're on your mold protocol. You're spraying your sinuses,
Yeah.
you're taking your binder, and like, okay, let's bring in some hormonal support. And what kind of what in what way does that kind of move the needle? So yeah, but yeah, thanks for clarifying
Yeah,
that.
yeah. For me, I'll just end with that. Like for me, I had done herbal stuff and like some libido herbs were helping me. And then I did get on more like creams and thyroid replacement. And wow, it was like big for me.
That's
Um,
great.
so yeah, yeah. So I just kind of wonder what it would have been like earlier,
Hmm.
but I'm definitely, yeah, really open minded to. I mean, I think hormone support is so important, and
Hmm.
sometimes you get lost in the conversation of mold and chronic illness. I don't totally know why. Maybe because it's like reproduction is sort of feels secondary to surviving what we're going through.
For sure.
But it can really make you feel better, right? Have more motivation, be less emotionally unstable. Can help for weight, help for sex drive. So
Mhm.
all that support can be, just really nice to making you feel like yourself again.
Yeah, absolutely. Um, And just another thing you mentioned earlier, which kind of sparked this other question. So you were saying, paraphrasing a little bit, but where it took a while before you found a clinician who actually asked you about mold exposure and your environment and whatnot. And I'm just wondering, because I know one of the things that I run into in practice, and I've refined this over time, so I'm a lot better at it now. But I know in my earlier days of screening patients for mold illness, sometimes it's like pulling teeth trying to get them to acknowledge or think about the possibility that they might have mold exposure. There seems to be sort of maybe this cultural aversion or something where people don't want to admit or acknowledge that maybe they did have a mold exposure. So I kind of have my way of teasing that information out of folks in a kind, compassionate way. But I'm wondering if there are certain questions that you ask clients, or ways that you kind of tease that information out to see if they might have mold, because I think most folks think like, oh, unless I see like my walls are covered in black, I don't have a mold issue. So it's just too easily dismissed. Are there certain questions that you ask clients to tease that information out?
Yeah, I can answer that, but I'll say I'm in a pretty unusual or different situation, which is since I talk so much about mold,
Mm-hmm.
people usually come to us
Okay.
either having had testing, they're usually already somewhere in the process.
Right, right.
They're, so they're pretty bought into the idea by the time they
That's
come
fair.
to us.
Yeah, yeah.
But yeah, I mean, I put in my book some of that stuff because I do think people like, any kind of like salty looking water stain can be mold. Any kind of mildew in the shower can be mold. Like, there's just a lot more than people think. And like, just how well, have you ever measured the humidity in your home? Do you clean your gutters? Do you clean your HVAC? Like, there's sort of a checklist you can think about with your current home, looking under sinks and looking in basements, kind of using your five senses to get, occasionally it really is fully hidden in the wall and you're getting no information. And then you can think about other places too, workplace, places you lived as a child, colleges and dorms. Dorms and college living are a big problem. Military housing, we're hearing more about. So sometimes you do have to go back in time. Um, and then, it's always like chicken and egg. Do we test like the home? Do we test the body? If people just maybe like coming to you, they're just chronically ill, you can test the body and see what's coming out. It's not perfect test, but pretty good. And then from there, you can maybe think about more of the environment. Unless you already are really heavily or thinking about the environment, then you may want to start there. So I think it can go either way as far as where to start, but like just a visual inspection of your home and thinking about your workplace, and then checklisting your symptoms. There's so many, right, that could be related to mold. And then just I think every case is unique. Like, what's your budget? Do you rent or own? Like, and then you think about what testing to do next.
Hmm. Great. Yeah, those are all really good points. Um, in terms of folks that you've worked with historically, just out of curiosity, what percentage would you say, like just ballpark, like what percentage would you say are um, sick with they're having mold illness because of an environment that they're in currently versus an environment that maybe they were in like years ago? So like I'm in my home right now. There was a flood in my basement a few years ago. I started getting sick a couple of years after that. So more of a current situation versus like, oh yeah, like I lived in that really moldy dormitory for 4 years, and that's when I started developing all my chronic fatigue, and here I am 10 years later, and I don't live in that moldy dormitory anymore, but I still have the residual symptoms of mold illness. I'm just wondering, in your experience, kind of how often do you see either one of those scenarios?
Well, we definitely see more currently still in the place, maybe just moved out. The moving part is not really one that anyone likes, so they're often still in the place. But I have seen and tested some people who, have had their home tested, but can think of an older exposure. Frankly, when I first started to get those, I was surprised because I was like, I can't believe it's still
Mm-hmm.
there for so
Mm-hmm.
long. but you can just be kind of recycling it for a long time. And if somebody's been chronically ill for 10 years, just like we see with every mold case, like it's probably not just mold, right? It's probably several things going on.
Probably.
And mold has just kind of helped weaken the immune system and such, disrupted the gut or the brain. So, you know, as much as I very much think mold is a big, big contributor to most chronic illness, it's
Hmm.
not the only player.
Hmm.
So, um, yeah, for better or worse, people often have to just like open up that Pandora's box of everything they've accumulated over the 50 years of their lifetime or what have you.
Hmm. And just kind of another question that sprang to mind while you were talking there, just where you do have, we'll say more of like a niche or a biased population, if you will, of folks who are, dealing with mold or are more likely than not to be dealing with mold, or mold illness. I'm wondering how, have you seen many cases where patients are having chronic digestive issues. So, gas, bloating, abdominal pain, constipation and or diarrhea, whatever, like the typical kind of spectrum of symptoms. And like they've been really thoroughly treated like every which way. Like they've been, screened for and or treated for like H. pylori, SIBO, large intestine bacterial overgrowth, yeast overgrowth, parasites. They've been on digestive enzymes, stomach acid, ox bile, cholagogues. Like they've just done everything under the sun to help their gut health. And yet they still have digestive issues, and then once they're treated for mold, that finally resolves their digestive issues. I'm wondering if you've seen cases like that, and if so, have you seen many of those cases?
Yeah, it's really common. I don't know if you tuned in. We had a mold summit last year that we're going to do again this year.
Hmm.
And one thing that kind of occurred to me as we did the interviews was that multiple food sensitivities was really a common symptom for mold.
Hmm.
And when you're having multiple food sensitivities, you're probably also having, IBS and different symptoms. So there's just definitely a lot of constipation in this community too. And I mean, it's similar to my own journey. Like I was doing all this good work, all the testing, and it was getting somewhat better. But it's like I was kind of the same as a lot of my colleagues. Like I was meticulous with my diet, right? And
Hmm.
like, so it kind of kept some things at bay. But I certainly couldn't be straying off my diet. So yeah, I mean, it's just such a huge disruptor to the gut, creates leaky gut, creates inflammation, makes infections more probable. So yeah, I think it's a big thing. Although I will side note it that I was just talking to a friend of mine who um, kind of went through that when she had implants. Uh, so that's also could be a thing like if you're not seeing, digestive symptoms or other symptoms getting better. So, just, yeah, again, like another type of toxin that could be just disrupting the body.
Hmm. And my understanding, having seen some really gross pictures at some conferences, like sometimes implants can be mold contaminated as well. To my understanding, like have you seen any of those pictures before of like
Yeah, yeah,
mold?
I've seen it, but like I haven't yet heard. It seems like they haven't, like, they don't often do like the actual testing to
Right.
see what's on the implants afterwards, but there's got to be something out there. I think they just, most people don't bother. I think a friend of mine had him out and it was like another $800 to have him
Sure.
tested. So, yeah, I have heard of that for
Right.
sure.
I,
And I
I,
just think, yeah, all the other stress on the body, they're leaking, they're blocking the lymph,
yeah,
that
it's
kind of a
wild.
thing. Yeah.
Yeah. Yeah, it's really unfortunate. Um, so let me see here. So another question I had for you. So I noticed on one of your Instagram posts, you'd mentioned about hydrogen tablets, and I'm just wondering if that's something that you've often recommended for folks, and if so, what kind of clinical impact you've seen those have over the course of time.
Yeah, they're not in our shop, so I've sort of just recommended them more like offhand in some blogs and stuff. But I was introduced to those from Datis Karazian's work,
Hmm.
um, talking about especially exercise intolerance, which
Hmm.
certainly some of our moldy people can are experiencing pretty
Hmm.
severe. So it just is a boost of antioxidants to put that in its Quicksilver brand. I think it's
Hmm.
called H2 Elite or something like that.
Okay.
So you could do those potentially like before and after your workout. You don't want to like push way beyond your limit, but like if you're wanting to, you're in the road to recovery, you're trying to exercise more, but you still don't, get sore, you don't recover well, it could be a nice boost. I think all the, I'm super interested in antioxidants right now in general. I think they can play a lot bigger role in detox than people realize. Um, we become just usually severely antioxidant deficient from being in mold or, just being chronically ill. So yeah, that's just like one little cool hack of in the family of antioxidants.
Yeah, I don't think it's very well known either. Like it's not often I hear people talking about hydrogen, and just yeah, just don't think people know about it. And
Yeah, I still would like to know more. I'd like to like
mhm,
do a blog. I think there's a machine you can do to make hydrogen water too.
yeah,
How about
yeah.
you? Do you utilize it?
I've played with it a bit. It's actually a little bit challenging for us to get hydrogen products in Canada. There's
Okay.
there I think Research Nutritionals. I think we can get them from them pretty easily now. But for a while, like there were no companies that would ship the products here. I got like a batch shipped to me once, and the company after was like, "So that was an accident. We weren't supposed to do that." So apparently, I had illegal hydrogen
Oh gosh.
tablets. But yeah, it's just weird. But anyway, so I kind of went on a little kick, and I have one patient in particular. She just loves them. Like she just did so well with hydrogen. But I didn't really have a chance to try it with that many patients. I took some myself just to see if it would improve my sports performance, but I wasn't having any chronic health issues anymore at that point, so it didn't really help me. But I think it's fascinating, and I've looked into like buying the hydrogen generating machines and things like that, but I just haven't taken the plunge. It's a bit of a rabbit hole to get into. There's
Yeah.
lots of information out there.
Yeah, same. I'd like to, and I think the coach who works for us had also recommended it to me to try out. But sometimes, like you're trying so much stuff, you're like, what does this even be doing? But yeah, if I think if you're feeling like just fatigue coming back, and definitely exercise fatigue, you can be using it. I think potentially like 4 times a day, um, as just kind of like a boost, a quick boost. I like a quick boost when I'm chronically ill. So, it's nice to have something that feels like it's making a difference.
Of course. Yeah, it's nice when there's that obvious tangible change. Yeah, and just for folks listening, like there's, to my understanding, like there's a lot of research evidence on hydrogen. Now, some of it's, I think actually quite a bit of it, if memory serves, is on like inhaling hydrogen gas, if I'm recalling correctly. But there is some on oral hydrogen supplementation too. So just FYI for folks that are listening. Um, and you mentioned how you're quite on a bit of an antioxidant kick these days. So I'm just wondering what kind of, outside of hydrogen tablets, what other types of supplemental antioxidants or foods, or like what's on your top five list, let's say, right now for antioxidants, if you don't mind sharing.
Yeah, I found the work of, I think his name is Lester Packer.
Hmm.
And I feel like his work has not been appreciated enough. So he wrote this book in '99 about the antioxidant network and how the certain 5 antioxidants work together. So it's
Mhm.
glutathione, ALA, vitamin C, vitamin E. I feel like I'm missing one now. I probably am because that's only 4.
It's only four.
Um,
You named the ones I
well,
was
we'll see
thinking
if
of, so
we'll
I'm
see if
not
it
sure.
comes to me.
Sure,
Yeah.
sure. Mhm.
And then there's a lot of herbal like not vitamin antioxidants, but antioxidants like in other ways, like grapeseed extract and curcumin. I mean, there's a gazillion, right? There's a
Mhm.
gazillion food-based antioxidants.
Mhm.
Um, so yeah, I've just been like learning about more about those and experimenting with those more. And I see in the mold community like some of these being talked about, but less so others. I mean, certainly you don't hear about like vitamin E in there. Maybe because it's gotten more known for like heart health. But I'll have to come back on when I have this all dialed in a little tighter.
Yeah,
But
sure.
certain ones recycle each other.
Hmm.
Um, and it's pretty cool. So, like getting those five while you're going through detox, I think is a great idea. And then just like having more herbal teas and or doing something very intensive like liposomal curcumin. Like there's a lot of options.
Hmm.
Um, but yeah, and just having emphasis on colorful foods, variety of foods, like something we know, but I think like just knowing the really like the value of all those little flavonoids and antioxidants, um, it's a big deal. It's a really big support for your body, because I think we just think like, oh, you get exposed to toxins and then there's inflammation. Well, what's like the cause of that inflammation? It's like usually like the oxidative stress on the body, of these toxins. How can I explain this well? But I don't think we really hear about like mold putting the body like in an oxidative stress state. At least I don't. I hear about it that much. It doesn't seem like. So, but that is, and it is what's happening, and it is what's happening with a lot of chronic like diseases too, like heart disease and dementia and stuff. So, yeah, I definitely, want to be bringing antioxidants into the conversation more.
Yeah, they're super important. And just kind of dovetailing on what you said, I think there has, what in my experience anyways, there's been more conversation, I think, in the last maybe year or two that I've heard, just around the importance of maintaining the health and integrity of our cell membranes, and including our mitochondrial membranes, which are very similar to our
Yeah.
cell membranes, and how, if those lipids are getting oxidized, that causes a lot of membrane dysfunction. And so I think there is like a little bit more of a, something out there in the ether, a little bit more around like preserving the cell membrane integrity through antioxidants more so. And to my understanding, vitamin E is the most important or most prevalent fat soluble antioxidant. So where glutathione gets so much hype because it is amazing, and our bodies are more water than non-water. So if it's the best water soluble antioxidant, vitamin E is the most important fat soluble antioxidant. Then there I think there's quite a nice marriage between the two of those, so to speak. Um, Also, just a
Yeah.
quick little plug, and I just want to mention this quickly because it's just, I guess I'll just call it a pet peeve of mine. But you go look at most supplements that have vitamin E in them, and it's just alpha tocopherol. And just a little PSA here for folks listening. Vitamin E is actually a family of 8 different molecules. There's 4 tocopherols, 4 tocotrienols. So just when considering a vitamin E supplement, to my understanding, it's quite important to make sure that we're getting, not just alpha tocopherol. We want all the members of the family, hopefully in good representation. So, um,
Yeah, so you know your vitamin E. Yeah, I mean, I think that's it. And like we're always hearing about like glutathione for mold, but it's like we're
mhm,
never talking about vitamin E or the types
mhm,
of vitamin E. And you're absolutely right about the cell membrane. Um, so yeah, there's a good one from Designs for Health. There's probably other good brands too. It's good for the skin too. I mean, when you start reading about these antioxidants, like they're so protective of so many things.
mhm.
So they're just awesome to like get to know, in my
Yeah,
opinion.
they are fantastic. And actually, I always forget to mention this earlier in the podcast, but just to clarify for everyone listening, we're not giving any medical advice today. This is all for informational purposes only. If you need medical advice, please talk to your healthcare provider about that. So we're just providing information. Um, on the antioxidant conversation train here, just I know that you're, well, we were chatting a little bit beforehand, I think, before we went live here with the recording, and also from some of your Instagram posts. I know you're an advocate of the Dutch test, which we use that in our clinic as well. One of the markers on the Dutch test, if you do the Dutch complete anyways, as you know, is that 8-OH-DG marker, that 8-hydroxy deoxyguanosine, I believe is the full name for that one, as a marker of oxidative stress on our DNA. And I'm
Yeah.
just wondering what your experience has been with 8-OHDG in terms of, whether you feel in your experience that it's been a sensitive indicator, or if that level is high, it means there's more DNA damage, suggesting there's not enough antioxidant activity. Do you find that picks up quite accurately how often folks need antioxidant support, or what's your opinion on that test
That's a great
marker?
question. Okay, before I answer, the fifth one is CoQ10. It was
Ah,
driving
there we
me
go.
crazy that I forgot that. Yeah, I haven't seen that marker that high on
Mm,
that many people.
me too.
But like, come to think of it, one of the clients I did see it high end. She had had cancer. She was seeing us more for just like hormones and recovery,
Hmm.
and then later tested high for mold.
Hmm.
So, we used to do more women's health before, more detox. So it does make me wonder it. But like my own Dutch, when I was going through things, that marker wasn't high. But I was always really supporting, my body too. So yeah, I mean, for me, when I've talked to Dutch, unless that marker is like out of range, they've been kind of like, don't worry about it. Which I wonder if there's a way to measure that more sensitively, like if you're halfway there, is that a bad sign? What do you
Hmm.
think?
Yeah, I've been really I really take it with a grain of salt. Like if it's high, I'm like, oh my gosh, like you really need
Yeah.
antioxidants. But I've yeah find that it's very rare that it's out of range. And there's actually another lab marker that I don't know, stumbled upon in a sense. And as we run this panel through the lab doctors' data, I'm sure other labs probably do it too. We just like doctors' data because they're well priced. I have no affiliation with them whatsoever, but we just like them. And they have this marker called oxidized LDL. LDL, for folks listening, is kind of what's oftentimes referred to as bad cholesterol, which is a misnomer because it's not actually bad. We need it to live, but if you have too much of it, it may be associated with increased cardiovascular event risk. But basically, they do this sort of subtyping, if you will, where it gives you your total LDL and then it tells you how much of that is oxidized. And the oxidized LDL, again, for folks listening, is the form of this quote unquote bad cholesterol that can get incorporated into plaques in the arteries, and that's why it can be potentially problematic. So what I've found, interestingly enough, is that when they have an elevated oxidized LDL, then that seems to be a pretty good indicator of when they need more antioxidant support. So then we put them on, usually glutathione, like a liposomal glutathione, as well as a mixed tocopherol, mixed tocotrienol, vitamin E, along with whatever else makes sense with supporting their case. And like just you can pretty much set your watch to seeing how that oxidized
Oh,
LDL comes
cool.
down really nicely. So it's been a really really cool surrogate marker, or a really cool marker. And I think that even though it's like a little bit of an indirect thing, because it's like, well, how much of this oxidized thing is kicking around in the bloodstream? I think it's much more useful than the 8-OHDG personally. So that's my
Yeah, I'm gonna have to look that up because there aren't a lot of great tests for antioxidant
no,
status that I've
no,
heard
not
of.
really.
No,
Yeah, they're few and
no.
far between, and it's like such an important thing. It would be so nice to have that information, but that's yeah. And unfortunately,
Yeah,
it's only through a blood test, so it's not like you can just do a urine oxidized
do it
LDL.
from
But
home.
yeah,
Yeah,
but you'll be able to
yeah,
get
and
some sense of
there's
it.
some markers on the organic acid and this and that, but I don't
Yeah,
find those to be 100% through and
no,
through
no,
either. And then I know there's like levels in the blood versus in the cell, and like,
yeah,
I mean, I think you can pretty much say anybody going through chronic illness of any kind needs more antioxidants. Um,
quite possibly. Yeah, and
yeah,
the
and
proof.
go ahead.
Oh, thank you. I was just going to say the proof is in the pudding, right? Like, how do people feel when they go on the antioxidants? And granted, sometimes they're just kind of like a supportive thing in the background. But I've had so many patients where, we start them on liposomal glutathione, like, they're on their binder, they're on their, methylation support, they're doing their nasal spray, they're doing whatever for their protocol. And then we add in liposomal glutathione as just a single new variable, because of course, many folks with mold issues or other chronic issues, they're very sensitive. We have to phase in one thing at a time, very methodical. And once we get in certain antioxidants, whether it's glutathione or vitamin E in some cases, or maybe CoQ10 or others, then like for some folks, it makes an obvious difference. They feel like their brain is clearer, their pain levels are less, their detoxification function seems better. So I think the proof in the pudding is, well, do you actually see clinical results when you add these things in? And we see it all the time.
Yeah, yeah. And the way we all take in antioxidants and especially like polyphenols from foods, if our gut is damaged and our cells are inflamed, like it can be different for everybody, right? How one feels versus the other. But yeah, there's luckily a lot to choose from. And, I just, again, was studying a newer course with Jatis Karazian on aging, healthy aging. And, he's just like, take as many oxidants as you can. It's so protective for your DNA. And, there's just so, there's of course a million like lifestyle habits too, good for aging, which a lot of them are just like socializing and, you know, stuff that's really simple.
Mhm.
But antioxidants are really great for that. So it's more of an interest of mine now in this point of my story is like, how do I age really well and feel good, which is kind of what everyone wants. And a lot
Mhm.
of antioxidants are pretty affordable, make them part of your lifestyle. Um, so yeah, I'm a fan.
That's good. Me too. It's interesting to me how in my experience there's quite a lot of overlap in terms of what's good for kind of optimizing your health when you're or like when you're healthy and you want to optimize your health and maintain your health. There's so much overlap with those practices as what you need to do when you're chronically ill as well. So like
Yeah,
ironically, even though I mostly work with folks with complex chronic illness, when folks are 100% or some occasionally somebody comes in like I'm healthy and I want to stay that way. It's like, oh, thank goodness, an easy case for once. But like the things we talk about are really similar, and so there's just a lot of overlap there, which I find to be quite
yeah,
interesting.
that's a fringe benefit for sure. And, I
Mhm.
just still do a lot of my same detox practices that I
Mhm.
did. I
Mhm.
sauna, I coffee enema, I Epsom
Mhm.
salt bath, take my antioxidants. Um, and, not only have I recovered for the most part, and
Mhm.
anyway, I just do feel like I'm actually, doing better than most people in my age group just because I've learned to take care of myself so well. So I
Great.
think, and I've heard that from clients too, right? I was already in the health background when this happened to me, but I've heard that from clients too. They're just like, I would never go back to, eating fast food and like feeling like crap again. Like I feel great, I'm active and it's awesome.
Yeah. It's almost like a weird little like parting gift of like, so you had this like crazy, pretty awful experience with your health, but at least the one silver lining is like, okay, like now you have all this knowledge and these tools, and you're hopefully going to avoid maybe some of the chronic health maladies that a person may have been more susceptible to. It's like, hey, with these health practices, probably less likely to have cardiovascular disease or maybe certain types of cancer or diabetes or this or that. So there can be that positive kind of feed forward, at least after going through so much.
For sure.
Yeah. Um, I know we're kind of starting to round the bend here on our time that we have together, but just a couple of quick things I wanted to sneak in here. So I'm a really big proponent of talking about mitochondrial health and function. I've been known to say that they're just really everything. There's really no facet of health that doesn't is not involved with them, or that they don't have their tendrils in. And I'm just wondering if there are specific supplements or things that you think about when it relates to either mitochondrial support treatments or tests around mitochondrial function, or how mold might impact mitochondria. Any words you could
Mm,
share around the mitochondria?
yeah, yeah. I'm a big fan of mitochondria too, for
Mhm.
sure. One of my practitioners early on, Suzanne Bennett, has written a book on mitochondria, and I just a small book. I read it and did some of the practices in there. So yeah, I'm a big believer in supporting them. And again, it's a lot of the overlap. Like they're sensitive to environmental toxins.
Mhm.
Um, they love like CoQ10. They love antioxidants.
Mhm.
Exercise is really good for them. Um, Sauna is good. Um, kind of like all the detox practices I think are good. I haven't gotten as much into NAD, but I actually just, been ordering some for myself to experiment with more.
Mhm.
There's a different nutrients needed in that process of creating energy that can support mitochondria. So there are different like nutrients for mitochondria. I would say in my own recovery, exercise part was a pretty big deal.
Mm.
Actually, it helped me a lot, and I was like floored at first. Like I would go to the gym, and there was a sauna that you could turn on with a knob, and I'd be like, "Oh, I'm gonna work out," and then I'd just lay on a bench. Like I had no energy to work out, and she really stressed the importance of it. And I was surprised, like how quickly it did come back when I did, step by step. It really brought my energy back. So, a
That's
lot of
great.
us are losing muscle mass, and like, becoming pretty lethargic and all that. So, to whatever extent you can, I think movement is really important.
Mhm. Which is a wonderful segue to the next thing I was going to ask you about, which is lymphatic system support. Because generally speaking, if we don't move our body parts, our lymph doesn't really move a whole heck of a lot. And so I'm just wondering, I know you have, I've seen a few of your posts about lymphatic system support on social media as well. Um, any, could you speak a little bit to ways in which you recommend lymphatic support for folks?
Yeah, I love dry brushing at home. I love sauna. Um, just recently I found a clinic that has some more advanced lymph techniques. They use a machine called Lymph Star. Have you
Hmm,
heard of it?
no.
It has like
What
this
does it do?
wand with these negative ions in it, and then
Hmm.
it has a laser. So he told me that dry brushing is more superficial lymph vessels, and this is deeper.
Hmm.
Um, so I've just had two treatments, and they were really impressive for
Wow.
me. So,
Cool.
um, I usually am a pretty big fan of like telling you to do stuff at home. You can bounce on a rebounder, you can go to yoga, you can take walks,
Mhm.
lots of ways to support lymph movement. Um, but I am excited because I think I've been doing those things for years, right? And now I'm
Mhm.
trying this new thing. And I was like, whoa, it is kind of next level to do some potentially like professional treatments that get a little
Yeah,
deeper.
that's great. Yeah, one of my favorite anecdotes to tell patients, because I refer some folks for manual lymphatic drainage, and especially if they have a lot of edema and things like that. And like I've had, I had one patient where every time she would get her MLD treatment, she would urinate out like 3 liters of water afterwards, and like she'd go
Oh
from
my
like
gosh.
tree trunk limbs to like normal limbs. Like so, it just kind of speaks to the fact that the right type of or a deeper type of lymphatic support, which manual lymphatic drainage would be in that category, can just have these profound benefits. Like you're never going to see that with dry skin brushing. It's great. I love it.
Right.
Recommend it all the
Right.
time. But like, so a deeper sort of acting treatment could, yeah, obviously have a significant, a further significant impact. So that device sounds really cool.
Yeah, and I did have some lymphatic massage or lymphatic technique when I was sick, and I was surprised that I had like a Hertz reaction. And I
Mm,
was like, oh, so the second or third one I took binders, but yeah, the first one moved a lot, definitely more than a dry brush
yeah.
is going to. So, I think people get to pick their own path, and everybody's usually on a budget by the time they're
Mhm.
going through everything with mold, but yeah, I think especially when I was really sick, my lymph was just so congested, like, constantly swollen glands, just like almost like
Mhm.
feeling my groin crease just heavy. And I would, do squats and dry brush it. I really think getting right in your groin crease with a dry brush is really good idea. And then also up here, I learned that
Mhm.
from like the lymph star, just like above and below the breast, really important too. So yeah, I learned some new things from from that treatment.
Yeah, lymph is very cool. It's yeah, definitely very special topic. Excuse me for just one second, Bridget. I apologize. I just need to pause this. I'm at work still, and they're knocking on my door
Oh,
insistently.
okay.
So excuse me for
Okay,
just one
something's up.
second. Sorry, folks. Just going to pause the recording for 1 sec. All right. Sorry about the lapse there, folks, and thanks for your patience there, Bridget. So another question I have for you just before we wrap up. Just wondering what types of interventions you found to be the most useful to help mitigate symptoms of mast cell activation. Of course, it's so important to actually treat the root cause and get the mycotoxins out and the whole kit and caboodle there. But in terms of say mast cell stabilizers or histamine metabolizers or histamine receptor blockers, just wondering what kinds of things you found to be the most helpful for folks over time.
Yeah, I'm probably not the biggest expert on that. I kind of learned it a little late. Trying to think of some things I've tried. Um, well, I've definitely like tried Allegra. Like, sometimes those over the counter ones
Yeah, they can
are
be really helpful.
helpful.
Hmm.
High dose vitamin C. Some people need to avoid histamine foods
Mm.
for a while. Like, unfortunately, sometimes even avocado is getting people, but definitely
Hmm.
like alcohol and cheeses and that kind of a thing.
Hmm.
It's interesting, I've tried some different herbal histamine blockers. Maybe my dose wasn't high enough. I haven't really felt like the relief yet from
Hmm.
it. Um, since I moved away, since I moved from Oregon to Arizona, I've developed more asthma from, probably my mold history plus, the pollution stuff here. And so it's been like one of the things that really hung on for me. And
Hmm.
interestingly, and we'll see because we're kind of off season, but when I started to get those lymph treatments, I feel like that shifted something for me. Um, so what we kind of discussed, at least for me, that maybe I was still in some of that mast cell, like, overreacting to the air and stuff, was just kind of still cellular debris or, debris in me from all the infections and everything I've gone through. So we'll see. We'll see in the spring if
Indeed.
if I'm less sensitive enough. But it's just been
Mhm.
interesting. It's like you said. It's like another friend at Scott from Better Health was like, well, if you still have mast cell, you still have a trigger. Work on your gut. I am doing actually like a parasite cleanse right now for liver flukes. So yeah, ultimately, I think the deeper things like are where it's at, but we all have our different thing, whatever, getting to that, because
Mhm.
I'm mostly better, but this one thing has been lingering for me. So yeah, I'm trying to get to some deeper causes and treatments.
Mhm. Well, thank you so much for taking the time to speak with me today, Bridget. And I know that just before we wrap up here, I know that you have some offerings for folks. So just if folks are wanting to sort of tap into your brain more or work with you or work with an associate of yours by proxy, could you just speak a bit to what kind of offerings you have? And I'll put whatever you're saying here in the show notes for folks.
Yeah, thank you. Well, our main site is just my name, BridgitDanner.com. We have a bunch of free ebooks, some on mold and some on the brain. Excuse me. And we do, if you catching this kind of live time, we have this free mold summit coming up. It starts February 27th. So we have, I don't know, 35 or however many different types of mold experts from the home to the body. So if that's a topic of interest, and Brian can share that. I do have a mold book on Amazon, including Canada. Uh, One of the easier ways to get to me from Canada. We do see clients virtually from all over. Just sometimes we can't run all the labs, but a lot of our clients will do lab reviews with us that they've had run before, just to get like another opinion. We'll help you with protocols. So yeah, we have a ton of resources. We're just, you know, cranking them out all the time. So happy for you to just come and like take a look and get involved.
That's great. And just if folks did want to access virtual care, is that through your website as well, or how is that done?
Yeah, you can click over the shop. Our shop is actually called Functional Detox Products, which is our brand of supplements. But the labs and like consultations are there as well, as far as like
Okay.
some of our partner companies, like probiotic companies and stuff that we work with. So we're a little different in that we're like more retail than practitioner based. So most of our clients have never seen us. They just kind of learn from our resources. And again, they probably, they may have someone like you, or most people takes a village to get better.
Mm.
So we're just like playing our role in that.
Great. Well, yeah, I was on your website before, and yeah, there's a lot of resources and things on there for folks to check out. So again, I'll put the website in the show notes. And yeah, thank you so much for taking the time to speak with me today.
Yeah. Thanks, Brian.
And thanks so much to everyone listening. So this ends another episode of the Overcoming Chronic Illness podcast. Thanks so much for listening, and we'll catch you next time.